Hello, my name is Lachlan Brown-Bates, and the following is a presentation on the placebo effect amongst college-aged men and the differences of maximum repetitions before and after the consumption of a product. The placebo effect is mainly known as a medicine that improves psychological and psychophysiological traits. The placebo effect is essentially making people believe that the product that they are taking will help them for the desired needs. This treatment will help with a range of conditions including pain, sleep difficulty, depression, anxiety, Parkinson's disease, and immune functions. Limited research has been put into the topic. However, this as a result, it is still unknown whether it has psychological or physical improvement qualities. The following experiment analyzes whether there are some physical improvements within participants. Other variables that may factor into the physiological aspects of the experiment can include motivation, expectancy, and conditioning, and the interaction of these variables with psychological variables might be significant factors in driving both positive and negative outcomes. This suggests that the current findings most likely will be similar. Placebo containing caffeine suggests similarities in a number of different energy boosters and creatine for gym, as most weightlifters will be using the boosters to help increase energy levels and as a result lift more weight. Caffeine has been shown to increase work output time to exhaust anaerobic power and training volume. Placebo having evidence of caffeine will suggest that there will be a difference in results. Even the smallest amount can alter the research. It has been suggested that the caffeine and related compounds enhance physical working capacities and as such should be considered as ergogenic aid. The test that was undertaken seen 15 college men do their maximum number of repetitions at 80% of their maximum lift. The two lifts that were undertaken by the participants were the upper body bench press and the lower body squat. Some baseline testing was performed prior to the testing session, so that the maximum or 1 rep max for the lift is known, and then the maximum reps at 80% of max is known beforehand. To initiate the placebo effect prior to testing in session 1, participants were instructed to consume a supplement composed of a powerful amino acid compound that has been proven to increase skeletal muscle strength and endurance by 10 to 15% after the completion of test 1. The placebo effect is then negated by the same instructor telling participants another university just completed an independent study on the same supplement and found the supplement had no effect on the skeletal muscle strength or endurance. The supplement does not work. Participants then undertook the testing for session 2. In the 6 months prior to the experiment, the 15 participants conducted very similar workouts to the session about to be undertaken. These sessions would be 3 days a week and provide the baseline study for the best lifts done by the participants over the last 6 months. The participants also had their weight, height, age, and body fat recorded for the first session they undertook. On top of this, the participants' diet was also recorded before the session. Kilocalories, proteins, fats, and carbohydrates were all taken. A FAM session was run to notify the participants of the testing that would be about to take place. As seen here in Figure 2, a trial run was also given to the participants to demonstrate how the test would be performed. A 3-day food diary was gifted to the 15 college men so they can record what they have eaten throughout their days to ensure that no large amounts of caffeine had been taken. The baseline session being the first session, participants were informed on the demographic testing process. This was also the first session where the participants lifted weights and had their results recorded. Trial 1 had the participants take the placebo, which they believe added a 10 to 15% increase in weightlifting. After consuming the placebo pill, the participants undertook the 4 exercises and had their weights recorded. A 4-day rest period was taken prior to the first trial, and then in trial 2, the participants were told the placebo pill doesn't have any effect on the results. The participants then again did the 4 exercises and had their results recorded. Once the data was collected, it was set out in sections and analyzed using real stats in Microsoft Excel 2010. A two-factor without replication analysis ANOVA was used to break up the overall data. The ANOVA was set to an alpha value of 0.05, and from this data was analyzed and compared to the p-value which RealStats had produced. This program was used for all exercises including the dietary consumption. After all the data was analyzed with ANOVA, a post hoc paired sample t-test was used to find if there was a significant difference between baseline and both trials, and trial 1 and trial 2. After all was completed, the data was looked at and the results from the test were completed. After all the analyzed data was recorded, a table, or figure 3, was created to identify the standard deviation for each exercise and the mean amount of weight lifted. Figure 3 demonstrates the increase in mean weight lifted and the baseline test compared to trial 1 and trial 2. This was evident in all exercises except for 80% bench press for maximal repetitions. The thought was that after taking the placebo pill that there would be an increase of performance, and as seen in the data, this thought was found to be correct, with the mean amount of weight lifted increasing by 13 kilograms for 1 rep max squat, 6 kilograms for 1 rep max bench, and 1.9 more max reps in 80% squats. This is a large increase from baseline to both trials, showing that with the knowledge of having enhancements, it can produce a different belief and as a result, alter the results. This being said, in trial 2, after being told a different college ran a similar test and found no result, the participants still had a substantial increase from the baseline results. This shows that after the first trial, the participants had the mental thinking that the pill increased the weight, whereas the participants had the capability. Comparing the two trials, it's evident that they were very similar. There is no significant difference in the exercises. This demonstrates that participants didn't alter their lift knowing that the pill didn't have any physical enhancements. Placebo, however, is known for its psychological effects, which is the potential reason for the increase in trial 2 still. The results were then analyzed to see if the placebo effect had any impact on the upper and lower skeletal muscle strength and endurance. The results clearly show that both trial 1 and trial 2 compared to the baseline results had noteworthy differences, showing that when the participants believed the pill they had taken increasing their skeletal muscular strength and endurance by 10 to 15%, it increased the results of 1 rep max squats, 1 rep max bench, and 80% squats for max repetitions. Although between trial 1 and trial 2, there was no real difference, this indicates that the participants were affected by the placebo pill not having an increase in results. It shows that they could achieve the heavy lifting in exercise the whole time. Overall, it is obvious that the placebo did affect the participants' results in trial 1, as there was a substantial increase in 3 of the exercises from the baseline results. This was evident in both trials for all 3 of the lifts. Only the 80% bench press for maximal reps seen no significant increase. This even after participants learnt that the pill had no effect in trial 2. The participants still lifted similar to trial 1. Overall, there was no substantial difference between trial 1 and trial 2 for each exercise. This indicates that the idea of an energetic aid helped the participants lift heavier weights still.